It's always a wonderful time to do this with you every week on the program Health Watch, reaching you from your number one station, the station for excellence, NTA Lagos Channel 10. This week, we're looking at malaria as we approach World Malaria Day, which is usually marked on the 25th of April. We'll be looking at what are the causes, the symptoms, and ways to prevent malaria. According to WHO, an estimated 1 life in every minute is lost to malaria, and most of this death occurs around the WHO African region. It has become imperative to look for ways to end malaria. On this episode, Dr. Jairus Abba will be talking to us about the causes, about the symptoms and ways to prevent malaria. Plus, we have a special report on breastfeeding. WHO, UNICEF and other international bodies continue to emphasize on the importance of breastfeeding to both mother and child. And in this special report, Dr. Nkiru David, a consultant pediatrician with the Nigerian Institute of Medical Research, will be telling us about the benefits of breastfeeding both to mother and child. All of this in this week's edition of Health Watch. My name is Nkem Okibe. We'll go on a short break. When we return, we'll listen to the interview with Dr. Jairus Abba on malaria. Stay with us.
Malaria is a disease that really disturb our communities. Malaria is a disease that caused by a parasite. That parasite is always spread in the community by a bite of mosquito, and it causes fever and body weakness, and those are the things that malaria does in the body system. And also malaria is a disease that is common in Africa. In Africa, in the communities, so more than 250 million in the world are affected by malaria, and also more than 500,000 die yearly because of malaria. So malaria is a threatening disease that are very, very important to take care of in this our society. Symptom of malaria is clear. One, the symptom of malaria, first of all, you must have fever. Two, you have difficulty of breathing. That's part of the symptom of malaria. You have severe headache, and you have also nausea. You feel like you want to throw up. Sometimes you have a diarrhea. It comes with a diarrhea because it's affecting your upper GI. So you will have a diarrhea. So sometimes also you will have a serious abdominal pain because of the parasite have attacked the GI. You will find difficult to eat. You will lose appetite. So you will feel also fatigue, pain. All your body, you will feel pain. And you have also rapid heart rate will be increased because of the fever. You see that the fever will be high in your body system. So you begin to have a heart rate will be increased. That will show that you have a symptom of malaria. So the symptom of malaria is clear before you can diagnose a patient that this patient has malaria. First of all, the factors is the environment. That is number one. Let the environments need to be clean. We cover ourselves by wearing a thick cloth to avoid malaria to bite you. And also travelers, people that travel states, different country, You go where you see that the level of mosquito is high. So those are also factors that also affect or getting malaria. So malaria in pregnancy is the risk factor. Those are the risk factor of malaria. Risk factor of malaria is, first of all, we have children under age, that's 5 years down, and also we have malaria in pregnancy. In the first trimester of the pregnancy, you will start experience the symptom of the pregnancy. The symptom of pregnancy will bring out the fever. It will bring out the fever. So the woman will experience a lot of nausea. She will feel like she wants to throw up. She will have a body temperature. She will have a lot of symptoms that will come up within her body system. That is where, if care is not well taken care of, you will find out that that pregnancy will have issue. That's why you see sometimes you will see at the earlier stage, they get threatened abortions, they get all those miscarriages. Those are the things contributed to that pregnancy. Malaria is a very dirty disease that have a serious complications. First of all, when you have not treated the malaria very well, the first thing that you will have the complication is a cerebral malaria. When you have cerebral malaria, it will affect the blood cells in the brain. So that person will have serious problem with brain complications. Also, the second complication, also you will see that organ fail. Especially when organ fail, you begin to have accumulation of fluid within the lungs. When you have accumulation of fluid within the lungs, you will find out that they have enlargement of the lungs. You will start experience some complications. The organ will not function the way it used to function before. So that is also a complication of malaria. Second, the third one also, you have a breathing complication, breathing problem. You will find out that the blockage of the pipe from the lungs, you will find it difficult to breathe off. Before you know, you will find that you will see that your lungs have been affected. Also, we have also a complication like low blood level sugar. You will get a sugar level will drop. The sugar level will drop because of severe stomach pain, severe GI problem. You will start getting a low sugar level. Those are the complications of malaria if it's not well treated. Those ones that are really affected by this malaria is children under age from 0 to 5 years. 0 to 5 years. And also old age. Those are the people that malaria is constantly affecting them. Also, we have also the pregnant women and with their unborn child. Those are the group of people that they are at risk when they are exposed in malaria. What the community have to come in is, first of all, malaria is caused by an infected mosquito. So the mosquito need to be well handled by the communities. Clean their gutter, make sure that the environment around within the environment is clear. Because when you allow dirty water and allow a forest or dirty environment, you will bring more mosquito. When mosquito have come in, you will see that the malaria cases will be increased in the community. Secondly, government need to come in by sharing some materials, some things that reduce malaria risks in the community. Because if the government is not bringing things that can help the community to clear this dirty disease like malaria, you will see that the rate of death will be increased in the community. So it's good the communities need to work on their environments. Right now, malaria vaccine in other countries have been approved by their government. But in Nigeria, we are looking forward for government to come up with the malaria vaccine, so that at least when the children is born in the hospital, they now give them the vaccine, so that it will reduce the risk of malaria in the age of 0 to 5 years. Because without this vaccine, the spread of malaria is high. So if government bring this vaccine into use, believe that it will reduce a lot of risks of malaria to spread in the country. So I urge the country, urge the Nigeria government to do much as possible to provide us the vaccine, so that we can now be using the vaccine like other countries that are using it. My message is this: malaria have been tormenting this country for a long time. So my message is, let government try much as possible to bring us material things that can be able to eradicate malaria in this country. And also let the communities also help themselves, because government cannot do everything for you. You help yourself. Most of things that you know that it can be a threat to you within your community, you must take care of those things, so that to avoid accumulation of mosquito around the area. Clearing of the drainages, and also all the places that are supposed to be taken care of by environmental communities. Those are the messages that we always try to pass across for this country. So let the country try their best to bring things that will help us to clear this malaria out of this country.
And that's all we can take on this week's edition of Health Watch. Remember that I normally say health conscious people live longer. You have questions, you have inquiries, and of course there's a topic you'd like us to treat, please send a message only to 07060865487 or send a mail to okibinkem@gmail.com. Thank you for being part of this week's edition of Health Watch. My name is Nkem Okibe. See you next week, same time, same station.